Welcome everyone from sunny Australia. It's nice to be here in our morning, your evening, and I see somewhere like in Sweden it's midnight. So thank you for joining, and welcome to day 3 of this to speak to listen to our 2 plenary speakers, whom I'm very, very excited to hear from. I think you'll all agree that this has been an absolutely wonderful symposium, and congrats to Jeff and the team for pulling this off, given the circumstances that we're all dealing with at the moment. My name's Grant Edwards. And I'm a mental health survivor, having been diagnosed with complex PTSD. For 34 years, I was a member of the Australian Federal Police, attaining the rank of commander, retired last year, and now I'm the head of Aspect Group Psychology Frontline, supporting wonderful people of law enforcement and emergency services. So I've been given the stick. It's critical that we stick to our time, and I'd like to firstly introduce our first speaker, Sherri Martin. Sherri currently serves as the National Director of Wellness Services for the Fraternal Order of Police, the FOP, the largest representative organisation of law enforcement officers in the United States. Sherri was a career police officer, served most of her law enforcement career as a patrol supervisor and lead crisis negotiator. While a member of the Charleston Police Department, she achieved the rank of lieutenant and was responsible for development of programs in areas of officer wellness and crisis intervention. Sherri has substantial academic qualifications and is a clinical therapist. Sherri led the Fraternal Order of Police National Officer Wellness Committee in a landmark survey of police officers on the subject of critical stress, stigma, and use of wellness services. If you want to look at more of Sherri's bio and her background, please, I direct you to the website and have a look there. So I'll turn my video off now and hand it over to Sherri.
Thank you so much, Grant. I appreciate that introduction, and I appreciate you sharing with us and being here from Australia. I'm envious. It's warm there, and it's heading towards winter here. I'm going to just pop up my screen real quick. To share with you guys. So I'm honored to be presenting today. I'm going to try to talk quickly because I have a very short time frame. I hope most of you have been able to attend the first 2 days of the symposium. I myself have gathered a lot of insight, and I look forward to connecting with some of the other presenters in the future and some of you watching. I had the honor of participating on the planning committee for the symposium, and I want to thank Jeff Thompson for getting this together. He was the lead organizer of this, and what a feat it's been, but extremely, extremely important. Other folks I would like to thank that have been mentors of great assistance to me, and most importantly, the members of the FOP, as we work to build wellness programs for police officers across the country. A little bit before I get started, I want to talk a little bit about the FOP. Trying to get my, hang on one second. There we go. I want to give you guys a little bit of information about what the Fraternal Order of Police is. As Grant said, we're the largest representative organization of law enforcement officers, active and retired, in the country, and actually in the world at this point. We have just over 355,000 members in all 50 states of the United States, as well as members in the District of Columbia and Puerto Rico. We also have international lodges in Canada and Ireland. So I want to give a shout out to all of our members out there who may be watching this presentation. Our organization is managed entirely and directed by professional, active, and retired law enforcement officers with member-elected officers on our executive board. And before I get started talking about the important steps we've been taking in the area of officer wellness, I'd like to give a little background information about the FOP. We are the voice of our nation's law enforcement officers. Our mission is improving the working conditions of our law enforcement officers and the safety of those we serve through education, legislation, and community involvement. A little bit of history about how the Wellness Committee came to be and the Division of Wellness Services. In its early beginnings, the FOP focused primarily on advocacy for members of law enforcement through labor and legislative action. 2 Pittsburgh, Pennsylvania officers, Martin Toole and Delbert Nagel, led the charge to form the first FOP lodge in 1915. They realized that there were strength in numbers, and they wished that if they improved their working conditions by organizing, they would have a better chance. So it took some 85 years for the profession to accept that critical incidents had an effect on officers and our working conditions, until around 2001, the National FOP established a critical incident committee to work on assisting our members who had suffered critical incidents. In 2013, as we began to recognize that there was much more to wellness than a reaction to critical incidents, the committee transformed into the Officer Wellness Committee. Then, due to increased focus on the rate of police suicide, the Wellness Committee decided that we needed to do more. And we began to build some programs, which I'll discuss in just a minute. Then in late 2019, the FOP took the position that it was a necessity that officer wellness become one of the pillars of our organization, much as labor and legislative advocacy had always been. I'm proud to say that we now have a division of wellness services. As director of wellness services, I'm fortunate to work with a dedicated committee of members who each have expertise in law enforcement, mental health, and the mission of our organization. We were fortunate to form a key partnership in 2018, which propelled this focus on wellness. In cooperation with a team of journalists from NBC, News 4, and New York City, we conducted a survey of our membership on issues related to mental health and wellness for our profession. And I'll give some background about that survey and share how that got us to where we are today. A little bit of background. News 4 New York had done a previous study with firefighters, so members of the International Association of Firefighters, and 3 journalists, Evan Stolberger, David Ushery, and David Manny, came to the FOP, and they said, you know, this went really well with the IFF. We want to do this with police officers. So through a series of face-to-face meetings, we developed a survey and then began to distribute that in the summer of 2018. This is kind of what it meant for our members. It was an online format, which we did through SurveyMonkey, 29 multiple choice questions. It took them about 5 to 10 minutes to complete. It was completely anonymous, which is key. And then the participants had the ability to skip any question. We wanted as much widespread participation as possible, keeping in mind that we only wanted sworn law enforcement to participate, whether they were active or retired. We wanted it to be easy to access, quick to take, and easy to understand. So we ensured participants through an explanatory informed consent letter, the purpose of the survey, how it came about, and assured them that they would not be able to be identified by their responses. And then the response is something we weren't expecting. So we got a pretty even response. Over 8,000 officers responded to this survey across the country, and we were pretty happy with the distribution across regions because we felt like it was pretty representative and pretty even. And then we looked also at time on the job. The link to the survey was guarded so that we were sure that it only went to members of our organization, so that we were sure that it was only active and retired police officers responding to the survey. And we included retirees. We asked them to consider their time on the job when they answered the survey questions, and this is the response that we got. We asked about military service. And the reason why we did that is we wanted to speak to the level of issues that have come directly from law enforcement service. We know also that the military is ahead of law enforcement in being proactive in dealing with the issues that we're talking about today. So to start simply, we came up with a definition of what we called critical stress. And we wanted to get down to the meat now of what we learned. We asked how many, you know, if you've ever had this critical stress, this definition, 79% of the survey respondents endorsed this, that said they had had it at some point in the course of their law enforcement duties. Then we asked if they believed that it was creating lingering issues for them. 69% said yes. So then we asked, how is this affecting you? And this is what they told us. You'll see the range of responses there. The biggest ones being things that we already know are related to post-traumatic stress disorder. What I want to point out, though, is that even you know, the things that are negative. So in the face of negative events, in the face of negative events, most of the respondents reported attempts to remain resilient. You know, instead of thinking of suicide, instead of resorting to substance abuse, they were doing other things, which we'll talk about coping next, to help them deal with some of these things. One key finding of the survey was this. Overwhelmingly, the most highly endorsed item in the survey, they believe that this stigma comes from a number of sources, which I'll get into in just a minute. The perception of stigma is creating barriers to seeking help, even in the first 5 years of service, and continues to increase, peaking at about 16 to 20 years of service, which we already know falls in line with data on suicides and the age groups that fall into that range. Here are some of the concerns about stigma and where it comes from. You can see there the top concern is being seen as weak or unfit for duty and putting their job at risk. So we can see why there might be a reluctance to seek help based on that. We asked about coping strategies. We note that most of the coping strategies here are productive, but that more people resorted to self-medicating with the use of alcohol or drugs rather than asking for professional help at work. And that's another key finding of this survey. Most of the strategies utilized were talking with non-judgmental people or engaging in productive uses of energy. Although 82% of officers are aware of behavioral health services, so EAPs and what have you, offered by their employer, barely 20% had used them. And then of those that did, just over half thought that they were helped by that. You know, and so we asked ourselves, could this be because there's a lack of trust in that service to begin with, that officers might go into that experience with a negative mindset? So then we asked about critical incident stress debriefings and critical incident stress management. 63% had participated in a debriefing, but then again, just slightly over half found it helpful. We asked about counseling outside of work, seeing a counselor outside the workplace, and you know, only about a third had done that, but so we're getting a little warmer. 80% thought that that was helpful, which has implications for going forward into the future. If officers are not willing to use department-issued services or not finding them helpful, but are outside their agency. And then finally, here's the golden nugget. Only about a third of our respondents had access to peer support or had used it, but of those that did, 92% found it helpful, and that's staggering to us. So this is what we did. We had all this information now straight from the mouths of police officers, and we went to work. We got busy, started putting together some programs there, and we found the consistent overarching lack of trust and confidence in wellness services. I'm trying to talk fast. Wellness services connected with police agencies or departments. And so even though we asked also about hotlines, substance abuse programs, and cops just weren't biting onto that. They weren't finding those helpful. So what do we do now? Well, we decided our first mission was to continue to generate awareness of the issue. The respondents in the 90% range indicated that there was inadequate awareness of mental health issues among law enforcement, both within the profession and outside the profession. In addition, some said they were not provided with enough behavioral awareness or education by their agency. So we said, we need to get the word out there. We need to be talking more about this. One thing that we are doing is a lot of our state lodges are leading the fight to work on legislation to have PTSD recognized as workman's compensation for first responders. Many states have been successful with this, but many are still in the fight with their legislatures. So we're working on that with them. Another thing that we're doing is we're creating the FOP approved provider bulletin. We've already begun work on this, and in the very near future, we'll have it published most likely on our website. Which will be a directory of vetted mental health services and providers that work specifically with law enforcement. Another thing that we're doing is we are developing standardized curriculum and peer support. This is in cooperation with the COPS office of the Department of Justice, and it's based on those findings from our survey. One thing that we're working on this curriculum now. It's currently in process. We've just gotten started on it, so look forward to that in the future. A little more about the Power in Peers curriculum. We know that there are 5 key types of stress for police officers, okay? So critical incidents are just some of those. We know that these other things come into play as well. And so we decided that as part of our research for designing the Power in Peers curriculum, we would ask our members what types of things they would seek out peer support help for. And you see here, now this is very early data. We have only just started collecting this data, but the early data is kind of telling to me. Most of us are taught that we should seek help after a post-critical incident, or after a critical incident rather. But we also know that there are daily stressors in the lives of first responders that take a toll on us. And so we wanted to make sure as we build Power in Peers that we don't forget about those things, that we're not reactive, but we're also proactive. We want to include a positive psychology component to this training so that our officers are taught to build on their strengths. I myself am a student of positive psychology. I was very happy to see Dr. Seligman here on day one, and I'm looking forward to the presentations that follow tonight about positive psychology, because that's going to be a key piece of the Power in Peers curriculum that hasn't been present in previous peer support programs. We're looking to build modules that agencies will be able to adapt to their size, the size of their community, the size of their department, and then bring in other key things that respondents to our survey might tell us they want to see peer support address. You know, maybe there's a need for a postpartum section, maybe there's a postpartum depression section, maybe there's a need for something else entirely. And those are things that we're going to consider as we build this curriculum. And so we have a lot of things in motion right now with our wellness division. We have training currently available. If members go to our website, there's a range of wellness training that they can bring to their lodge and their members already. We are now planning our second FOP National Wellness Summit. It will be in February 8th to 10th, 2021 in Nashville, Tennessee. So more on that to come soon. One thing that we're hoping to do as part of this year's Wellness Summit is to have a seminar and a networking event for those providers that are specializing in working with first responders, so that they can get to know the officers and the members participating in the Wellness Summit, and they can network with each other as well and learn more about the FOP and our approved provider program. As I said, we're developing standardized curriculum, Power in Peers, and we are developing the improved provider bulletin. Future directions for us. What we're going to do next is, as we go around the country and teach the Power in Peers training, that's going to naturally provide a network of trained peer supporters for us. And so we're going to, at that point, create a state-by-state directory of peer supporters. So what this will do for us is, you know, I know even in some agencies, officers are concerned about talking to a peer on the peer support team in their own agency, because there's a fear there that confidentiality may not be honored, that people will still know that there's something going on. And so they might want to be looking for someone outside of their agency. This Call on Peers program will allow a peer in, let's say, Connecticut, where I am, to call on a peer in Colorado who doesn't know them personally, doesn't know anyone in their agency, but understands their issues as a police officer and understands what kind of stresses they might be dealing with. And since we know that officers have peer support as their go-to, but then they're still concerned sometimes about confidentiality, this should erase that last piece of concern about reaching out for that hand. Another thing that we're doing, as I said, we have current surveys of our membership going on. We're surveying our membership about their experiences during COVID-19 and during the recent police protests and civil unrest. We realize that as the FOP, we are in a unique position to get the views and to hear the voices of our law enforcement officers, because if there is a mistrust of talking to agencies or talking to their leadership about any difficulties they might be having, that's should not be a concern with the FOP, because we are independent of any police agency, of any police administration, and our sole mission is just to benefit the members of the FOP. So we feel confident that, you know, we are getting to hear those voices, and we're speaking up and letting the rest of the profession know and the world know what our officers are really experiencing and what they're feeling. As I shared just a minute ago, the preliminary data on our peer support poll, we're going to continue to collect that and see what they tell us about, you know, where they want us to take the Power in Peers curriculum. Other things that we're working on, there are members of our committee working on some published research. I have been very fortunate to have some colleagues that I've published some research with. Dr. Jacqueline Drew was on yesterday leading a panel, actually it might have been the first day, and she and I have been collaborating on a few papers, recently published some recommendations for police management about helping their officers through the stresses of working through a pandemic. We're working on model policy and practice development on our committee. So getting information out and giving agencies and ideas and peer support teams some model policies and things that they can do if they don't have a policy to start developing one. And then finally, for our members, every month we develop a FOP wellness newsletter that's got wellness content. Each month we take a different aspect of wellness and we generate articles and all sorts of information that they can go to and have a look at. I always share this slide in every presentation I give. The FOP, we see ourselves on the Wellness Committee as collectors of information in one way, in that we want to find the best resources out there for our members, for all police officers, and let them know what those are and where to find them. So each of the hotlines you see here, we have personally vetted. We have faith in these hotlines and we recommend them. I find that when I put this slide up at a presentation, it's often photographed by audiences of police officers and they share it on social media and share it with their friends. Because oftentimes these confidential hotlines are going to be the first place that an officer in crisis is going to go. Very quickly, here is information for our committee. If you would like to learn more about what we're doing, feel free to email us. Also, if you know of a wellness program, a wellness professional, a treatment facility that you think is excellent, that works with professional first responders, shoot us an email and let us know who they are so that we can include them in our APB. And finally, here's my email address, my contact information, should you want to get in touch with me. And I have one more thing, but before I do that, I want to just quickly talk about our vetting process. So right now, our vetting process for our treatment facilities and our providers started a few years ago. We actually started this process before there was even a wellness committee. And what we do when we vet these facilities is we physically go there. And we talk to the participants in the program. We see their living conditions. We see how they live. We ask them, what the treatment is like for them. We check out the facilities, the programs that are offered. And each of the 4 facilities that we've designated as approved provider for facilities are excellent. Their services are excellent. And so we're happy that we have those resources to refer our members to when they need a hand. And that's the same sort of process that we're looking at developing for our individual practitioners. We are working with professional police psychologists to develop a standardized vetting framework for clinicians so that we can then identify these clinicians, which we've started to do already through our membership. So we've asked our members, who do you know in your state? Who do you know in your town that's a good clinician? Who have you worked with and who's helped you? Because we want to take those recommendations and use those first. And then from that network of clinicians, we're going to build and, talk to other clinicians that they know. And eventually, hopefully, we'll have clinicians all over this country that are practiced at working with first responders. So that's more to look forward to. We're very excited about what we're doing. I can't say enough about the folks that work with me on the Wellness Committee. Each of them is very dedicated to the work that they're doing. And as I affectionately call them, the 355,000, that's my mission. More than anything, I want to express my appreciation to the 355,000 because they are, and the rest of law enforcement all over the country and frankly all over the world. They are, you're all my brothers and sisters. Those of you police officers that are out there listening to this, and we hope that the work that we're doing on the Wellness Committee is going to be the best work that we can possibly do to benefit you.
Sherri, thank you very much. That's outstanding. And I mean, thank you for all you do and thank you for what FOP does. It's it's really critical work, and especially as you indicated, given what's happening in particular in your country at the moment and other places. So congratulations.
Thank you so very much. And I apologize I'm trying to talk so very fast so I can get it all in there. So.
No, the information's there, and I know I'll be going back over it once it's up on YouTube as well. So thank you again very much.
Thank you so much.
Yeah. Let's move on to our second speaker now, and our second speaker is Dr. Emma Seppala. Emma is the Science Director of Stanford University Center for Compassion and Altruism, Research and Education, and Facility Director for Yale School of Management Women's Leadership Program. She was also Science Director of Stanford University Center for Compassion and Altruism, and author of The Happiness Track and an international keynote speaker. She doesn't really have much else to do in her time by the looks of it. Very, very busy. So thank you, Emma. I'll hand over to you now.
Well, thank you so much, Grant and Sherri. Wonderful, wonderful presentation that definitely introduced the topic that I will be speaking of with you now. All right, so Sherri was talking a little bit about stress, stress on the job, post-traumatic stress, and as you know, the job of any police officer or first responder involves situations where you encounter life and death situations, whether you encounter violence or you have to engage in violence, whether you have to walk in on a scene that involves violence in some way, that brings up anxiety, fear. These are situations that can, in some cases, lead to post-traumatic stress. So I'm going to talk a little bit about that right now. It's now called post-traumatic stress. For a while, people were saying post-traumatic stress disorder, but it's actually not a disorder. It's a very normal reaction to a life and death situation here. So post-traumatic stress in the police affects 7 to 19% of the police force versus 3.5% in the general population. Police officers suffer from cumulative post-traumatic stress, so prolonged and repeated exposure. So veterans and general community too will also encounter these kind of situations. Military veterans have often encountered these situations during deployments. Otherwise, and the general population, even a car accident, one-time event can lead to post-traumatic stress. However, when it comes to police officers, there's this sort of cumulative, repeated, day after day sometimes, exposure to these very stressful life events. And that leads to, that can definitely take a toll on mental health. So what is post-traumatic stress? Involves some of the things Sherri actually looked at in her poll: recurring thoughts, dreams related to trauma, avoidance of stimuli associated with trauma, negative moods and cognitions, irritability, depression, rage, anxiety, sleep disturbance, and then exaggerated startles. So, and again, Sherri was also alluding to all of these things, this sort of overreaction to things that wouldn't normally provoke anxiety, but there's a very strong anxiety response. I have a picture here of David Brown, who's currently superintendent of Chicago Police. And I don't mean to have that picture because he has post-traumatic stress, because I have no idea. But his story is so vividly, it demonstrates this sort of repeated stress, having headed the Dallas police and had members of his force pass away, and then have his own son pass away at the hands of police because anyway, it's a long story and you have to read about it. Now he's just been placed at the head of Chicago Police in April, and now with everything going on in Chicago, just an example of the amount of stress that can come at someone, and this obviously does not have to be achieved for that to happen. So a little bit more about comorbidities with post-traumatic stress, marital and relationship problems, probably because of all of the negative emotional repercussions and irritability, anxiety, substance abuse. Sherri mentioned this sort of a self-medication, insomnia, very, very common, anxiety, depression, social isolation, trust can be impacted. But again, social connection, the things that Sherri's doing with peer-to-peer is so predictive of mental health and well-being. So when you isolate, you're actually sort of removing that support system. Rage and violence. So this can happen Very quickly, in the sense that with post-traumatic stress, sometimes there is a lack of ability to sort of control your impulses in the moment. So you might act out in rage in a way that you actually don't want to act out, would never have wanted to act out, and yet you did because that anxiety took over your nervous system. You're in this fight or flight response. So we've all heard of the fight or flight. Post-traumatic stress is like you're in fight or flight all the time, which is why you're unable to sleep, unable to relax, and can really act out in a way that you would rather not. Concentration and attention are impacted, which obviously impacts your job performance, and then suicide. So sadly, police suicides are greater than deaths in the line of duty. And we know that suicide is very tightly correlated with post-traumatic stress, with insomnia, etc. So what are current treatments? Pharmaceutical and therapeutic, exposure therapy, cognitive behavioral therapy. But there are some issues with that, is that research shows that 50% of patients who go through an entire course of treatment show no benefit. They're not helped. So what happens, the problems is that there's a high dropout risk. Often pharmaceuticals have side effects that can really interfere with your ability to function in life, to function on the job. And also pharmaceutics have mixed results. Therapy often involves revisiting the trauma, which can be very aversive, very unpleasant. And sometimes some people argue it can also be re-traumatizing. And then obviously the stigma that Sherri so deeply talked about, this inability to want to appear weak, etc., or perhaps a fear of losing your job. And then also, if you are someone who is going to become a police officer, if you're someone who wants to be a first responder, you are unwilling to look at yourself as a victim or to want to be dependent on another person or on, drugs, anything, because you're someone who takes responsibility. You're someone who has chosen a profession where you step up. And so there's also that's sort of another factor. So we looked at this question, we looked at a particular breathing practice called sky breath meditation, decreased post-traumatic stress in veterans with trauma. The population we looked at was veterans, which is very similar to police officers in terms of that post-traumatic stress. And again, as Sherri mentioned, many police officers actually are military veterans. So these were combat veterans. Why did we ask this question? Well, given that current treatments are not working so well, we wanted to try a completely different approach. So traditional approaches, for example, therapeutic approaches, are going to work with your mind, try and get you to think differently so that you can feel better. This can work in some situations. Exposure therapy can also work in some situations. But when there is high anxiety, it is sometimes really challenging to think your way out of a situation. For example, one of the veterans I worked with, he said, I'm in front of the mall. I know there's nothing going on in the mall. I know it's safe in there, but I have to brace myself for 20 minutes before I can walk into the mall. So you see, there's nothing wrong with his cognition. He knew that it was a safe place, yet his body is acting in a way that is not allowing him to go in because of the heightened anxiety. So here we wanted to look at a different approach. Rather than approaching the thinking mind, which is not 100% of the problem here, we needed to approach the nervous system from within. So sort of usually traditional approaches we can think of as top down. Here we wanted to approach it from bottoms up. Can we calm the nervous system using breathing, which we know is the fastest, most efficient way to calm your heart rate and blood pressure and so forth, and to tap into the opposite of the fight or flight, which is your parasympathetic nervous system, the calming response, the rest and digest. Can we do that? Can we try that approach? So that's what we did. I'm not going to go over this. This design slide is really there for you later to look over if you wish. We had a rather small group of participants, but our effect sizes were large. And as you will see, we had longitudinal findings. So really very promising findings. So I will share with you here. The pictures you see here are from our actual study because there was a documentary made about our study. So we have permission to use these pictures. The participants engaged in a lot of breathing called sky breath meditation, and as well as some other group processes and social connection, a little bit of those positive psychology aspects that Sherri alluded to earlier. So what did we find? Well, the first thing we looked, the main thing we're looking at was anxiety, post-traumatic stress. And what we found was here, what you're looking at in the blue arrow, the blue columns are the control group that did not go through the intervention, and the red columns are the active group that went through the intervention. How long was the intervention? It was a 6-day intervention, couple hours a day. The participants met every day after work for a couple of hours and did these breathing exercises, etc. So time one is that first set of columns, was before the intervention. Time two was exactly afterwards. So those 7 days later, we saw this significant decrease in PTS symptoms, such as hyperarousal, which is, like I was talking about, that startle response, but also in the other symptoms mentioned below and also in our paper. But, you could send someone to a massage for a week and probably see, similar results. So how do you know if this is really working, right? So we wanted to look at time 3, which was 1 month post. And again, we looked at whether the results had changed. And in fact, they were the same 1 month post. And then we were fortunate to gather data 1 year later as well. And 1 year later was time 4, and we saw the same. So it was almost like that anxiety, that post-traumatic stress had, in a sense, been healed for the long term. In fact, sometimes some of the veterans will, journalists will want to talk to some of the veterans in our study, and I'll contact the veterans, and they say, I don't even remember what my life was back then. I've moved on, to the point where, these people were living in their basement, smoking pot and drinking, unable to function in some cases, and yet have been able to move on. So very, very promising. Now, if you ask, they might have just liked us a lot, right? And just answer whatever we wanted. So what we really like to do is gather physiological information as well to make sure that what they're saying is actually what we're seeing at the level of the nervous system. So what we did was measure startle response. What is that? Startle response is, as I was mentioning earlier, sort of a hyper reaction to a small event, right? But that happens when you have high anxiety. So in this case, we actually had them sit in a small room where the lights were going on and off, and they were hearing loud bursts of white noise at random moments. Now, this would be mildly annoying to someone with no anxiety, but if someone has post-traumatic stress, it's actually very, very startling. One of the veterans said to us, "This is worse than the SEERS program," which is the prisoner of war program in the Marine Corps. So we really didn't want to torture them, and believe me, we tried. This was the least aversive of the kinds of experimental manipulations we could have done. But what we saw here is, what we did is we correlated the decrease in anxiety. So this is what it looked like. We measured startle response around the eyes. This is an actual picture from our study. And what we did for you who are statistics buffs, we correlated the decrease in anxiety seen in their answers to the questionnaires with decrease in startle response in this sort of very aversive paradigm of having them sit in that room with all of those random noises and lights going on and off. And the correlation was 0.9. So that's a very strong correlation. So there's a very strong sort of relationship between their reduction in anxiety and what we're seeing at the physiological level, helping us feel really confident about our findings. Many people ask, well, did they continue breathing after the program? I mean, did they have to do this every day? The truth is, we measured that, and most of them did not. They did the program and they were done. They were off to their lives. They did not continue breathing, but it's as if that 1 week breathing program, that sky breath meditation, had this acute healing effect on their nervous system that allowed them to then move on with normalized anxiety. So what we're seeing actually is that many of the veterans no longer qualified as having post-traumatic stress after that 1 week, which is what we're seeing here. So this was really very, very promising, and we saw similar results for other anxiety measures that we looked at. And here we looked at respiration as well. So at time 1, respiration for both groups was the same. And at time 2, you see that the respiration for the active group, for the group that went through the breathing protocol, slowed down, suggesting that their fight or flight response was calmed. They were tapping into more of that parasympathetic rest and digest the calming response. So that was also very promising. Now, recently, we ran a study with a different group of stressed individuals, Yale undergraduates, which you would be surprised how high the stress is among that big group of overachievers who struggle to compete with one another and sort of prove themselves in the world, because they have learned that they have learned or believe that they need to prove themselves to sort of be worthy in many cases. And so what we saw here is we really wanted to look at different well-being interventions, because, you know, there are a lot of studies about this or that random well-being intervention that seems to work, but very few studies that look at well-being interventions side by side. And yet that's the only way we're going to know what works best, right? So we had the participants go through an 8-week program. It was 8 weeks simply because it was during the semester. The actual sky breath meditation program is short, but what we did was have, and the other programs as well, but what we did was have this sort of continued practice effect to see what would happen if they continue their practice for 8 weeks like this. And what we found was that the sky breath meditation of all the interventions had far more benefits at the end of the program. And I'm not going to share this with you because I'm not a primary investigator on this study, but this intervention has been studied with the police force in Brazil, and with a lot of success. With police officers, the police officers enjoy the program, and they're seeing a lot of benefits for well-being, but also for social connection among the police officers, and greater feelings of connection with leadership. So really promising results. And for anyone who's interested in that research, let me know. I will be happy to put you in touch with the research group in Brazil. So just to share some testimonials, because it's nice to put some words and some faces behind the data sometimes. This one from Nate Ruska, Marine Corps veteran, a few weeks ago: shooting, cars exploding, screaming, death, that was your world. Now back home, no one knows what it's like over there, so no one knows how to help you get back your normalcy. They label you a victim of the war. I'm not a victim. Again, veterans, police officers, not likely to see themselves as victims. How do I get back my normalcy? For most of us, it's booze and Ambien. It works for a brief period, then it takes over your life. Until the study, I could not find right help for me breathing like a champ. This was Rich Lowe. He was actually in the documentary, if you're interested in seeing it. I feel like I was dead since I came back from Iraq. I feel like I'm alive again. His father actually said, thanks for giving me my son. He said, I've got my son back. And Travis Sienna, thank you for giving me my life back. So again, they were in this study for 1 week, a few days, and saw these huge benefits. So I'm going to take some questions now. I didn't want to overwhelm you with data, but I did want to share with you also my email. And also, if you are interested in that breathing program that is offered for first responders, here's the website, skyresilience.org. And then the documentary film, if you're interested in looking at the documentary film for veterans that was on our veteran study, it's called Free the Mind, and it's available online. So happy to take any questions. I think I have a little bit of time. Any questions, feel free to really jump in on the chat.
There is one question that's come up already, Dr. Seppala, and that's from Bruce, who says, why sky breathe? Can any other breathing technique work as well?
Fabulous question, fabulous question. As a researcher, I really only feel comfortable sharing with you the research that I know and that I have seen work. So I have seen that this program works really well. There are many breathing exercises out there, and probably many work. What's interesting about the sky breath meditation is that it's a very comprehensive program. It involves a lot of different practices put together in a package that seems to be very effective in this sort of short amount of time. In 1 week, their anxiety was normalized. These were veterans with post-traumatic stress for whom pharmaceuticals and therapeutics in many cases had not worked. They had been through programs. So there's something about this breathing practice, at least from our research, that suggests that is particularly effective, efficient, and fast for people with trauma, anxiety. And I think we live in a world where we need things to be efficient and fast. So, but I can't speak to things I have not researched. So.
Doctor, just following up from that, Bobby's asked, can you give a brief overview of what sky is?
Yeah, absolutely. So it involves a number of different breathing practices. During the workshop, participants will engage in this sort of guided breathing, and then it involves a number of different steps that would probably take too long here for me to go through. You really do need to take a class for that. But what we know is that after the program, you get this sort of short 20-minute practice, just like you would maybe do a meditation or a relaxation of some sort that you can do on a daily basis. So that's what some people have chosen to do. In fact, some of the veterans actually chose to become instructors of this, which is really nice too, because then it's sort of veterans teaching veterans. By the way, for any of you who are military personnel, it is also available through Project Welcome Home Troops, which is a nonprofit that actually offers this program free of charge. Project Welcome Home Troops, yeah. Any other questions?
Dr. Seppala, I just want to say that was a fascinating presentation. Thank you so much.
You're more than welcome, Sherri. I feels like a natural partnership with you too. Yeah, so am I referring to transcendental meditation? No, there are many forms of meditation and they are all great, I'm sure. This is just the one, this is really a breathing technique. So it's different from meditation, traditional meditation, where you're using a mantra or following some instructions with your eyes closed. You're literally changing your breathing in order to change your nervous system. So we know, for example, that when you breathe in, your heart rate increases. And when you breathe out, your heart rate decreases, right? So when you lengthen your exhales, just a real simple exercise, you start to lower blood pressure, your heart rate. So that's just a tip of the iceberg sort of example of how breathing impacts your nervous system. And BPA Delirious asked what the nonprofit for military is. It's called Project Welcome Home Troops. And I believe the website is, I'll put that in here for everyone to see because I worked with them closely. There we go. Yes, and the other thing we know about breathing in particular is that's really tied to our emotions. So you'll see, for example, that when you're feeling anxious, your breathing is going to be more rapid. Same when you're angry. And yet what research shows is that when you actually change your breathing, you can actually change how you feel. And that's really powerful because from research on emotion regulation that was conducted in the lab I was in at Stanford, actually, it's very hard to talk your way out of an emotion when the emotion is very strong. If it's a mild emotion, you can talk your way out of it. But if it's very strong, real strong anxiety, real strong fear, real strong anger, rage, at that moment, I think we've all experienced it's very hard to talk our way out of it. That's again why we want to address the nervous system directly through breathing. How do individual officers get SKY if their organization doesn't have it? I'm a researcher, so I'm not sort of part of the SKY Resilience program, but this website that I have up, skyresilience.org, you can actually just contact them and find out about what your options are and whether you can take the class online. Everything is offered online anyway, so it doesn't really matter where you are in the world or so forth. Yep, I agree with Bruce. Everything needs to be evidence-based for sure. Any other questions? It's my pleasure and honor to be here, by the way. Really appreciate your being here with you all.
Thanks very much, Dr. Seppala. That was another outstanding presentation. I mean, what a morning and a good way to kick off day 3. I want to just thank everyone that is tuned in this morning, my time, this evening around the rest of the world, etc. It's been hugely informative. If you need to look or obtain any further information, can I direct you to the Resilience Symposium website? All the information is there, and I know that all these presentations will be put up on the YouTube site, I guess, once Jeff gets a chance to breathe. We'll finish up there now. Wherever you are, please stay safe, look after yourself, and in particular, look after your loved ones. Thanks again, and enjoy the rest of the day.